Hello and welcome to our health channel. We're so glad to have you here. Today, we'll be talking about a common but often underestimated health issue, diarrhea. Although it may seem minor, when left untreated, it can lead to serious complications, especially in children and the elderly. In this video, you will learn what diarrhea really is, its most common causes, symptoms to watch out for, medical treatment options, and most importantly, how to prevent it and protect your loved ones. So make sure to watch until the end. And if you find this information useful, don't forget to like, subscribe, and share with others, because your health is your greatest wealth, and we're here to help you protect it. Diarrhea, complete medical information. 1. Definition. Diarrhea, from the Greek diarrhea, meaning to flow through, is defined as the passage of 3 or more loose or watery stools per day. It results from disturbed bowel motility and impaired absorption of fluids and electrolytes in the intestines. It is one of the most common symptoms of gastrointestinal disorders and may present in an acute form, sudden onset, lasting less than 14 days, or chronic form lasting more than 2 weeks. 2. Etiology causes. Infectious causes. Viruses. Rotavirus, most common in children. Norovirus, often seen in outbreaks among adults. Bacteria. Escherichia coli, Salmonella, Shigella, Campylobacter, Vibrio cholerae. Parasites. Giardia lamblia, Entamoeba histolytica. Non-infectious causes. Food allergies and intolerances. For example, lactose intolerance. Intestinal diseases. Inflammatory bowel disease, Crohn's disease, ulcerative colitis, UC, irritable bowel syndrome, IBS. Medications. Antibiotics disturb normal gut flora. Laxatives stimulate bowel movements. Toxins, food poisoning. Emotional stress and psychological factors. 3. Clinical symptoms. Frequent, loose, or watery stools. Abdominal pain, cramps or spasms. Bloating, gas, and intestinal discomfort. Sometimes fever and chills. Nausea and vomiting. Fatigue and dizziness. In severe cases, bloody stools or dehydration. Signs of dehydration. Dry mouth, lack of tears, reduced or dark-colored urine, dry skin that retracts slowly when pinched, rapid heartbeat. In adults, confusion or reduced alertness. In infants, sunken fontanelle, soft spot on the head. 4. Diagnosis, clinical workup. Medical history, recent food intake, travel history, medications. Physical examination, abdominal tenderness, signs of dehydration. Laboratory tests. Stool analysis, microscopy, culture for pathogens. Blood tests. Electrolytes, Na, K, Cl, glucose. In severe cases, complete blood count, CBC, hematocrit, renal function tests. Treatment methods in detail. A mild to moderate cases. 1. Fluid replacement, main priority. Oral rehydration solutions, ORS, given in small amounts every 5 to 10 minutes. In children, 50 to 100 milliliters per kilogram per day as needed. Composition includes NaCl, KCl, glucose, sodium citrate. 2. Dietary management, medical nutrition therapy. Recommended foods. Rice water, dry toast or crackers, bananas, thin vegetable puree, boiled potatoes. Foods to avoid. Dairy products, especially if lactose intolerance is suspected. Fatty, spicy, and fried foods. Carbonated beverages and fruit juices. 3. Medications. Probiotics, to restore intestinal microflora. For example, lactobacillus, bifidobacterium. Antidiarrheal agents, used only in symptomatic, non-infectious cases, for example, loperamide. Not recommended in infectious diarrhea, as it may prolong illness. Antibiotics, prescribed only when bacterial cause is confirmed. Common agents, ciprofloxacin, azithromycin. Antiparasitic agents, used in cases of giardiasis or amoebiasis. Examples: metronidazole, tinidazole. B. Severe cases: hospitalization, inpatient treatment, intravenous fluid therapy for infusion, Ringer's lactate solution, or normal saline, electrolyte balance correction under close medical supervision, detoxification treatment if toxins are involved, prevention prophylaxis. 1. Hygiene: wash hands thoroughly before meals and after using the restroom. Teach children proper hygiene practices from an early age. 2. Safe food and water consumption: consume only well-cooked, properly handled meals. Avoid street food and raw, undercooked items. Wash fruits and vegetables before eating. 3. Vaccination: rotavirus vaccination for infants and young children. This is the leading cause of infectious diarrhea in children worldwide. Post-diarrhea psychological state and medical complications. 1. Psychological impact after diarrhea. Diarrhea, especially when severe, prolonged, or recurrent, can have a significant psychological impact, particularly in children, the elderly, or individuals with weakened immunity. Common psychological reactions: decreased quality of life and low mood, anxiety, especially in public or unfamiliar places, fear of social embarrassment due to unpredictable symptoms, mental fatigue and sleep disturbances. In chronic cases, depression or emotional withdrawal. Note: there is a strong link between gut health and brain function known as the gut-brain axis, meaning bowel issues can directly influence emotional well-being. 2. Physical and systemic complications after diarrhea. If diarrhea is severe or prolonged, it may lead to the following medical complications. A dehydration, the most common and dangerous complication. Rapid heartbeat tachycardia, low blood pressure hypotension, dizziness or fainting. In severe cases, acute kidney failure. B. Electrolyte imbalance, loss of key electrolytes like potassium K, sodium Na, and chloride Cl. Irregular heartbeat arrhythmias, muscle cramps, or weakness. In children, seizures, convulsions. C. Malnutrition, nutrient malabsorption during prolonged diarrhea. Weight loss, weakened immunity. In children, delayed physical growth and cognitive development issues. D. Gut microbiome disruption, especially common after antibiotic-associated diarrhea, leads to dysbiosis, loss of healthy gut bacteria, causes bloating, poor digestion, and increased food sensitivities. E. Chronic inflammatory conditions, persistent blood in stool may indicate underlying issues such as ulcerative colitis or Crohn's disease, both serious inflammatory bowel diseases, IBD. Doctor's advice: even if diarrhea seems mild, if it's recurrent, long-lasting, or causes physical weakness, it's important to consult a physician, preferably a gastroenterologist, for proper diagnosis and treatment. Healthy lifestyle after diarrhea. Doctor's recommendations. After recovering from diarrhea, the body is often weakened. To fully restore gut health, immunity, and energy, it's essential to follow a balanced and healthy lifestyle. 1. Proper diet gradual reintroduction. Start with light, bland, low-fat meals, rice water, mashed potatoes, bananas, dry toast, or crackers. After 3 to 5 days, gradually return to a regular, balanced diet. ADD probiotic-rich foods, unsweetened yogurt, kefir, to restore healthy gut bacteria. Stay well hydrated, drink plenty of water and oral rehydration fluids. Avoid temporarily dairy, especially full-fat milk, fried, spicy, or fatty foods, carbonated drinks, caffeine, sugary foods, raw fruits and vegetables for a few days. 2. Hygiene and infection prevention. Continue regular hand washing, especially before meals and after bathroom use. Eat only clean, well-cooked food from trusted sources. Limit exposure to crowded or unsanitary environments if immune system is still low. 3. Physical activity. After 1 to 2 days of rest, begin light activities like walking or gentle stretching. As strength returns, gradually resume normal physical routines. 4. Mental recovery. Ensure adequate sleep 7 to 8 hours per night. Minimize stress. Spend time in fresh air, relax, meditate, read, or pray. Listening to calming music and taking short nature walks can uplift mood. 5. Supplements only with medical guidance. Multivitamins, especially vitamins B complex, A, C, D, zinc, and magnesium, support intestinal repair and immune recovery. Probiotic supplements, for example, Enterogermina, Line-X, Hillockford as recommended. 6. Follow-up medical checkups. If diarrhea lasted more than 2 weeks or recurs frequently, consult a gastroenterologist or primary care doctor. Post-recovery checkups ensure full healing and help rule out underlying issues. Conclusion: recovery after diarrhea isn't just about stopping the symptoms. It's about restoring balance physically, mentally, and nutritionally. Your body heals faster when your lifestyle supports it. Your health is your greatest wealth. Taking care of yourself today leads to a healthier, happier tomorrow. If you found this video helpful, give it a like and leave a comment below. Don't forget to subscribe to the channel for more trusted and easy to understand health content. You are a valuable part of this community. Stay safe, stay healthy, and take care of yourself. Health is your power. Protect your health, protect your future. Small steps today, big results tomorrow. Subscribe now, let's grow stronger together.